Volunteers need to check in at reception, not wander around pretending to be doctors. Attending physician Dr. Marcus Donovan spoke without looking up from his chart as Dr. Serena Blake stood watching the trauma team work on a construction accident victim, her green scrubs and blue jacket professional, under the hospital's bright lighting. The morning sun illuminated the busy ER as Serena observed the patient's deteriorating condition, recognizing the classic signs of compartment syndrome that the team was completely missing. "His arm needs immediate fasciotomy," she said, stepping closer, her years of surgical experience evident in her confident assessment. Donovan finally looked up with an irritated expression, his short-sleeved white coat pristine as he gestured dismissively. "Ma'am, I appreciate volunteers wanting to help, but this is actual medicine, not whatever first aid class you took at community college." His residents snickered as they continued their inadequate treatment, completely unaware they'd just insulted the chief of orthopedic surgery at Massachusetts General Hospital, whose pioneering work in compartment syndrome had revolutionized trauma care, and whose intervention could save this man's arm and possibly his life. Welcome to Frost Folktales. This is where we tell the stories of those who were underestimated, dismissed, and targeted, yet chose courage over silence. If these stories move you, subscribe and be part of a community that refuses to let them fade into the background. Dr. Serena Blake had arrived at Millbrook Community Hospital that Tuesday morning for what should have been a routine consultation visit. As chief of orthopedic surgery at one of the nation's most prestigious medical institutions, she regularly consulted at smaller hospitals, sharing her expertise and reviewing complex cases. The bright fluorescent lighting reflected off her perfectly pressed green scrubs. As she walked through corridors she'd navigated dozens of times during previous visits. Her blue jacket, embroidered with her credentials, hung naturally over her athletic frame as she moved with the confident stride of someone who'd spent 15 years saving limbs and lives in trauma bays across the country. The emergency had unfolded just as she'd entered the trauma wing. Samuel Porter, a 43-year-old construction worker, had been crushed by falling debris at a downtown construction site. The paramedics had delivered him conscious but in significant pain, his right arm visibly swollen and discolored from what Serena immediately recognized as compartment syndrome. The condition was a surgical emergency she'd treated hundreds of times, where swelling within muscle compartments cuts off blood supply, leading to tissue death and potentially fatal complications if not addressed within hours. But Dr. Marcus Donovan and his team were missing every critical sign. The 38-year-old attending physician stood over Samuel Porter with an air of absolute authority, his short-sleeved white coat spotless, and his demeanor suggesting he'd never encountered a medical situation he couldn't handle. His perfectly styled brown hair and manicured appearance spoke to someone more concerned with image than medical excellence. The residents surrounding him, two young doctors in their late 20s wearing similar white coats, hung on his every word as if he were delivering gospel rather than dangerously incorrect medical assessments. "Look at the classic 5 Ps, Serena said, her voice carrying the calm authority of someone who'd taught these principles to countless medical students. Pain out of proportion to the injury, pallor, paresthesias, pulselessness, and paralysis. This patient is showing clear signs of compartment syndrome. His tissue pressures need immediate measurement, and he needs surgery within the hour to prevent permanent damage." Dr. Donovan turned toward her with undisguised annoyance, his blue eyes cold as they assessed her appearance. "Listen, I don't know what medical drama you've been watching, but this is real life. We're dealing with crush injuries and possible fractures here, not some textbook case you read about online." His residents exchanged glances, their expressions mixing amusement with condescension as they looked at the black woman in scrubs who dared question their attending physician's expertise. The patient on the gurney groaned in pain, his face pale and sweating despite the cool morning air flowing through the hospital's ventilation system. Samuel Porter's right arm had swollen to nearly twice its normal size, the skin tight and shiny with a mottled appearance that any trauma surgeon would recognize as critically concerning. His fingers, visible beyond the temporary splint the paramedics had applied, showed the dusky coloration that indicated compromised circulation. Nurse Dorothy Coleman, a veteran ER nurse in her 50s with graying hair pulled back in a tight bun, watched the exchange with growing unease. Her 30 years of emergency medicine experience had taught her to recognize competence, and something about Dr. Serena Blake's calm confidence and precise medical terminology suggested knowledge far beyond what any volunteer would possess. But the hierarchy of the hospital was clear, and Dr. Donovan's authority in the trauma bay was absolute. "You need to check compartment pressures immediately," Serena continued, her frustration barely contained as she watched precious time slip away. "Normal pressure is under 8 millimeters of mercury. Above 30 requires immediate fasciotomy. This patient's clinical presentation suggests pressures well above that threshold." Dr. Donovan laughed, a sound devoid of humor that echoed off the bright white walls of the trauma bay. "Compartment pressures? Ma'am, you're talking about specialized procedures that require years of surgical training. We're not going to start cutting into this man based on the opinion of someone who probably learned medical terms from watching Grey's Anatomy." His residents joined in the laughter, their white coats rustling as they turned back to their inadequate treatment plan. The medical equipment surrounding Samuel Porter's bed told a story that Dr. Donovan was refusing to read. The patient's heart rate had climbed steadily over the past 20 minutes, while his blood pressure showed signs of early shock. His oxygen saturation remained stable, but Serena knew that compartment syndrome's most dangerous effects were just beginning to cascade through his system. The damaged muscle tissue would soon release toxic levels of potassium and proteins into his bloodstream, potentially causing kidney failure and cardiac arrest. For viewers watching from places like Atlanta, Chicago, or Houston, this scene might feel familiar. How many times have medical professionals, teachers, or experts been dismissed not for their knowledge, but for assumptions made about their appearance or background? Dr. Serena Blake stepped closer to the patient, her trained eye noting details the trauma team continued to miss. Samuel Porter's fingers had lost their pink coloration entirely, indicating that blood flow to the extremities had been compromised for an extended period. The temporary splint applied by paramedics, while appropriate for transport, was now contributing to the compartment pressure by restricting the natural swelling that occurred with this type of injury. "Sir, can you move your fingers?" she asked Samuel Porter directly, her voice gentle but urgent. The construction worker attempted to comply, but only managed weak, limited movement that confirmed nerve compression from the mounting pressure within his arm's muscle compartments. "Ma'am, please step away from my patient," Dr. Donovan commanded, his voice carrying the authority of someone accustomed to unquestioned obedience. "You're interfering with medical care, and if you continue, I'll have to call security to escort you from the premises." His residents nodded approvingly, their expressions showing complete faith in their attending physician's assessment of both the medical situation and the unwelcome volunteer who dared challenge his expertise. Nurse Dorothy Coleman made subtle notes on her clipboard, documenting the patient's deteriorating condition and the unusual situation unfolding in the trauma bay. Her professional instincts told her that Dr. Serena Blake's observations were not only medically sound, but potentially life-saving. The way she spoke about compartment syndrome, using precise medical terminology and specific pressure measurements, suggested expertise that went far beyond volunteer training. The bright morning sun, streaming through the hospital's large windows, illuminated Samuel Porter's increasingly pale complexion as his body began showing signs of systemic stress. His wife Janet had been contacted and was driving to the hospital, expecting to find her husband receiving the best possible medical care. Instead, she would arrive to find a medical team whose pride and prejudice were preventing them from recognizing expertise that could save his arm and possibly his life. "This patient needs immediate surgical intervention," Serena stated one final time, her professional composure masking the frustration and horror of watching preventable medical negligence unfold. Every minute of delay increases the risk of permanent disability or death from systemic complications. The fasciotomy procedure I'm recommending is the standard of care for compartment syndrome. And this patient is presenting with classic symptoms that demand immediate action. Dr. Donovan's expression hardened as he faced what he perceived as continued insubordination from a volunteer who refused to accept her place in the hospital's hierarchy. "Look, lady, I've been practicing emergency medicine for 12 years, and I don't need medical advice from someone who probably couldn't even get into medical school. We're treating this patient appropriately, and your interference is both unwelcome and potentially dangerous." As Serena watched the trauma team continue their inadequate treatment, she realized that Samuel Porter's fate was being sealed not by the construction accident that brought him to the hospital, but by the prejudice and arrogance of medical professionals who refused to recognize expertise when it didn't match their expectations. The clock on the trauma bay wall showed that critical time was slipping away, and soon the window for successful intervention would close forever. What would you do if you possessed life-saving knowledge but found yourself dismissed and silenced by those in power? Dr. Serena Blake faced this impossible choice as she watched a preventable tragedy unfold, knowing that her next decisions would determine whether justice would eventually prevail or whether prejudice would claim another victim in a system that too often values authority over expertise. The morning sun continued streaming through the hospital windows as Dr. Marcus Donovan's ego and assumptions set in motion a chain of events that would soon expose the deadly consequences of medical prejudice and transform multiple lives forever. Dr. Serena Blake watched in growing alarm as Samuel Porter's leg continued to swell visibly on the trauma bed. The construction worker's face had grown pale and sweaty, his breathing shallow and rapid. Under the bright fluorescent lights of the emergency bay, every symptom screamed compartment syndrome to her trained eye. Yet Dr. Marcus Donovan continued ordering basic pain medication and elevation protocols that would accomplish nothing. "Doctor, his compartment pressures are likely over 40 millimeters of mercury by now," Dr. Serena Blake said, stepping closer to the bedside despite Dr. Marcus Donovan's earlier dismissal. Her green scrubs and blue jacket marked her as someone who belonged in this medical environment. But Dr. Marcus Donovan's expression remained dismissive. "He needs immediate pressure measurements and emergency fasciotomy within the hour to prevent permanent damage." Dr. Marcus Donovan looked up from his clipboard with barely concealed irritation. His short-sleeved white coat was pristine, unmarked by the urgency that should have accompanied this case. "I already told you we have this handled. We don't need volunteers making diagnoses. The 5 Ps are all present," Dr. Serena Blake continued, her voice steady but insistent. "Pain disproportionate to injury, pallor, paresthesia, pulselessness, and paralysis. His anterior compartment is rock hard on palpation. This is a surgical emergency." Dr. Claire Simmons, a first-year resident in orange scrubs, paused in her documentation. She had been watching Dr. Serena Blake's assessment with growing interest, noting how every observation proved accurate. The supposed volunteer had identified symptoms that the attending physician was either missing or ignoring. "Look at his dorsalis pedis pulse." Dr. Serena Blake pointed to Samuel Porter's foot. "It's barely palpable, and his toe capillary refill is over 4 seconds. Classic signs of vascular compromise from increased compartment pressure." Nurse Dorothy Coleman had been working in emergency medicine for 15 years, and she recognized clinical expertise when she heard it. Dr. Serena Blake spoke with the confidence and precision of someone who had seen this condition many times before. Her assessment was methodical, thorough, and medically sound in ways that Dr. Marcus Donovan's basic pain management approach was not. "The patient needs a needle manometer to measure compartment pressures immediately," Dr. Serena Blake continued. "Normal pressures are under 8 millimeters of mercury. This man's pressures are likely 40 or higher. which means his muscle tissue is dying as we speak. Dr. Marcus Donovan's face flushed red with anger. You need to step back right now. I don't know who you think you are, but you're interfering with proper medical care. I'm trying to prevent irreversible muscle necrosis, Dr. Serena Blake replied. Compartment syndrome is a time-critical emergency. Every minute of delay increases the risk of permanent disability, kidney failure from rhabdomyolysis, and potentially death from hyperkalemia. The medical terminology flowed effortlessly from Dr. Serena Blake's lips, each word precise and accurate. Dr. Claire Simmons found herself pulled between her respect for the attending physician's authority and her growing recognition that the volunteer seemed to know exactly what she was talking about. Samuel Porter moaned on the gurney, his leg now visibly more swollen than when he had arrived. The skin was becoming shiny and taut, stretched over compartments filled with fluid and dying tissue. His vital signs reflected increasing distress, with elevated heart rate and dropping blood pressure that indicated systemic complications. Dr. Donovan, Dr. Claire Simmons ventured carefully. Maybe we should consider the compartment syndrome differential. The patient's presentation does seem consistent with the volunteer's assessment. Dr. Marcus Donovan whirled on the young resident with fury. Dr. Simmons, you're a first-year resident. I'm the attending physician with 20 years of experience. We don't take medical advice from random volunteers off the street. Dr. Serena Blake felt her professional frustration mounting as she watched preventable tragedy unfold. The fasciotomy procedure involves making incisions over the anterior and lateral compartments to release pressure. It's a relatively straightforward surgical intervention, but it must be done within 6 hours to prevent permanent damage. We're already approaching 4 hours since his injury. Nurse Anthony Bell had been quietly observing the interaction while monitoring Samuel Porter's vital signs. The volunteer's medical knowledge was sophisticated and specific, far beyond what any layperson would possess. Her explanations of compartment syndrome pathophysiology were textbook accurate, and her sense of urgency matched the severity of the patient's condition. His creatine kinase levels will be sky-high from muscle breakdown, Dr. Serena Blake continued, her voice taking on a more desperate edge. The myoglobin released from dying muscle tissue will damage his kidneys. This isn't just about saving his leg anymore. This is becoming life-threatening. Dr. Marcus Donovan slammed his clipboard down on the nearby counter. Security! I need security in Trauma Bay 2 immediately. We have someone interfering with patient care who refuses to leave. The call for security sent a chill through the emergency department. Nurse Dorothy Coleman exchanged glances with Nurse Anthony Bell, both recognizing that something was seriously wrong with this situation. The volunteer's medical knowledge was impressive and accurate, while Dr. Marcus Donovan seemed to be missing obvious clinical signs. Please, just measure his compartment pressures, Dr. Serena Blake pleaded. It takes 5 minutes with a needle manometer. If I'm wrong, you've lost nothing. If I'm right, you could save this man's life and limb. Hospital Administrator Gerald Hartman appeared at the edge of the trauma bay, drawn by the commotion. He was a thin man in an expensive suit who rarely ventured into the clinical areas unless there was a problem that might affect the hospital's reputation or liability. What's the situation here, Dr. Donovan? Administrator Hartman asked, his voice carrying the authority of hospital management. We have a volunteer who won't respect medical authority, Dr. Marcus Donovan replied. She's interfering with patient care and creating disruption in the emergency department. Administrator Hartman looked at Dr. Serena Blake with the same dismissive attitude, seeing only someone who didn't belong in the sterile, high-stakes environment of trauma medicine. Ma'am, you need to respect our medical staff's expertise and allow them to work without interference. Dr. Serena Blake felt the institutional weight of the hospital's hierarchy aligning against her, despite her clear medical knowledge and accurate assessment. This patient has compartment syndrome. Every minute of delay increases his risk of complications. I'm not interfering with care. I'm trying to advocate for proper treatment. Our attending physician has made his assessment. Administrator Hartman replied coldly. If you can't respect that, you'll need to leave the premises. Dr. Claire Simmons watched the exchange with growing unease. The volunteer's explanations were medically sophisticated and internally consistent. Her assessment of compartment syndrome included details about pressure measurements, surgical techniques, and potential complications that demonstrated advanced medical knowledge. Dr. Donovan, what if we just checked the compartment pressures as a precaution? Dr. Claire Simmons suggested quietly. It would only take a few minutes, and if there's any possibility of compartment syndrome, Dr. Simmons, you're out of line, Dr. Marcus Donovan snapped. We don't alter our medical judgment based on input from unqualified volunteers. This patient has a simple fracture with associated swelling. Pain medication and elevation are appropriate treatment. Dr. Serena Blake pulled out her phone, hoping to contact someone who could intervene before it was too late. I need to call Massachusetts General Hospital. They have orthopedic surgeons who can confirm this diagnosis and accept transfer if necessary. Dr. Marcus Donovan immediately moved to block her access to the phone. You will not be calling anyone or involving outside physicians in our case. This is insubordination and interference with medical practice. The confrontation was escalating beyond medical disagreement into personal conflict. Dr. Serena Blake found herself fighting not just medical ignorance, but institutional pride and racial assumptions that prevented the staff from taking her expertise seriously. Samuel Porter's condition continued deteriorating as the argument raged around his bedside. His leg was now significantly more swollen, the skin stretched tight and beginning to show mottled discoloration that indicated dying tissue beneath. His vital signs reflected increasing systemic distress from the toxins being released by damaged muscle cells. Nurse Dorothy Coleman had seen enough. Dr. Donovan, the patient's condition is clearly worsening. Maybe we should consider all available options. Nurse Coleman, your job is to follow medical orders, not question attending physicians. Dr. Marcus Donovan replied harshly. Everyone in this department needs to remember their place in the medical hierarchy. Dr. Serena Blake watched precious minutes tick away as institutional prejudice overrode medical necessity. Her expertise was being dismissed not because her assessment was wrong, but because the staff couldn't accept that a black woman volunteer might know more about emergency medicine than their attending physician. The tragedy was unfolding exactly as she had predicted, with compartment syndrome progressing through its predictable stages while proper treatment was delayed by pride, prejudice, and institutional arrogance. Samuel Porter's life hung in the balance as his condition moved beyond the point where simple intervention could guarantee a positive outcome. The fluorescent lights hummed overhead as Dr. Serena Blake watched Samuel Porter's skin take on an increasingly mottled appearance. His leg was swelling beyond the normal parameters, and she could see the telltale signs of compartment syndrome progressing toward irreversible tissue death. Every minute that passed without proper intervention was sealing this man's fate. Dr. Marcus Donovan had stepped away to handle what he called more pressing matters, leaving the trauma bay under the supervision of his residents. This was Dr. Serena Blake's chance. She approached Dr. Claire Simmons, the first-year resident whose orange scrubs stood out under the bright hospital lighting. The young woman had been glancing nervously between the patient and the monitoring equipment, clearly sensing that something wasn't right with their current treatment approach. Dr. Simmons, Dr. Serena Blake said quietly, her green scrubs rustling as she moved closer to the bedside. I need you to listen to me very carefully. This patient's compartment pressure is reaching critical levels. Without immediate fasciotomy, he's going to lose his leg and potentially his life. Dr. Claire Simmons looked up, her eyes wide with uncertainty. But Dr. Donovan said we're monitoring the situation and that surgery isn't indicated yet. Dr. Donovan is wrong. Dr. Serena Blake's voice carried the weight of years of experience. Look at his symptoms. The pain is out of proportion to the injury. His pulses are diminishing. The skin is tight and shiny. These are classic signs that require immediate surgical intervention. The young resident's hands trembled slightly as she checked the patient's pulse again. "I can barely feel anything," she whispered. "That's because the pressure is compressing his blood vessels," Dr. Serena Blake explained, her frustration mounting as precious time continued to slip away. "We need to make incisions to relieve the pressure in all 4 compartments of his leg. The procedure should have been done an hour ago." Dr. Claire Simmons seemed to be processing this information when the sound of confident footsteps echoed across the trauma bay. Dr. Patrick Fleming strode in, his short-sleeved white coat pristine and his demeanor radiating the kind of arrogance that Dr. Serena Blake had encountered too many times in her career. He was Dr. Marcus Donovan's contemporary, probably mid-50s with graying temples and the bearing of someone who had never been challenged on his medical opinions. "What's the situation here?" Dr. Patrick Fleming demanded, his eyes immediately focusing on Dr. Serena Blake with obvious suspicion. Dr. Claire Simmons began to speak. Dr. Blake was explaining that the patient might need— "Dr. Blake?" Dr. Patrick Fleming interrupted with a harsh laugh. "You mean this volunteer who's been disrupting our trauma protocols all morning?" He turned to face Dr. Serena Blake directly, his expression cold and dismissive. "I don't know what kind of medical training you think you have, but this is a professional medical facility, not a community health fair." The words hit Dr. Serena Blake like a physical blow. Here was another physician making the same racist assumptions that had been plaguing her all morning, but with even more venom than Dr. Marcus Donovan had shown. She felt her professional composure wavering as frustration and disbelief warred within her. "This patient has compartment syndrome," she said firmly, refusing to be intimidated. "His life is in immediate danger." Dr. Patrick Fleming scoffed. "I've been practicing emergency medicine for 25 years. I think I can recognize compartment syndrome when I see it. This patient has a simple fracture with some expected swelling. Dr. Donovan's treatment plan is entirely appropriate." As he spoke, Dr. Serena Blake's mind flashed back to a similar case she had handled just 6 months earlier at Massachusetts General Hospital. A young athlete had been brought in after a motorcycle accident with nearly identical symptoms to Samuel Porter. She had performed the fasciotomy within 40 minutes of his arrival, saving both his leg and his life. The procedure had been textbook, the recovery complete. That patient had sent her a thank you card just last month, including a photo of himself running a 5K race. Another memory surfaced. A construction worker in Boston, not unlike Samuel Porter, who had been crushed by falling debris. The referring hospital had delayed treatment, and by the time he reached Dr. G's, Serena Blake's trauma bay, the compartment syndrome had progressed to the point where amputation was the only option. She had stayed with that patient through his recovery, helping him adapt to his prosthetic leg, watching him struggle with depression and financial hardship. The memory of his wife's tears still haunted her. "Please," Dr. Serena Blake said, her voice carrying the weight of those experiences. "I've seen this exact presentation multiple times. The patient needs immediate surgical decompression." Dr. Patrick Fleming's expression hardened further. "Are you questioning my medical judgment? Because I can tell you right now, whatever medical degree mill you attended doesn't qualify you to override the decisions of board-certified emergency physicians." The insult was so blatant, so openly racist in its assumption that her education was somehow substandard, that Dr. Serena Blake felt her hands clench into fists. She had graduated summa cum laude from Harvard Medical School, completed her residency at Johns Hopkins, and finished her fellowship at the Mayo Clinic. She had published over 50 peer-reviewed articles on trauma surgery and had been invited to lecture at medical conferences around the world. Yet here she stood, being dismissed as a fraud by physicians whose medical knowledge was clearly inferior to her own. Nurse Dorothy Coleman had been quietly observing the exchange while monitoring Samuel Porter's vital signs. The experienced nurse had worked in emergency medicine for over 2 decades, and she had developed an instinct for recognizing medical expertise. Throughout the morning, she had watched Dr. Serena Blake demonstrate a level of clinical knowledge that surpassed anyone else in the trauma bay. "Doctors," Nurse Dorothy Coleman said tentatively, her voice barely above a whisper, "I've been watching this patient for the past 2 hours, and everything that Dr. Blake predicted would happen has happened. His pulse is getting weaker, his pain is getting worse despite the medication, and his leg is continuing to swell." Dr. Patrick Fleming whipped around to face her. "Nurse Coleman, I think you should focus on your nursing duties and leave the medical decision-making to the physicians." The nurse's face flushed, but she didn't back down entirely. "I'm just saying that maybe you should consider following orders and staying in your lane," Dr. Patrick Fleming snapped. Dr. Serena Blake felt a surge of anger at watching the nurse being silenced for speaking the truth. Nurse Dorothy Coleman had been the only member of the medical team to show any recognition of her expertise, and now she was being punished for it. The sound of hurried footsteps and anxious voices approached the trauma bay. Janet Porter rushed in, her red sweater bright against the clinical white walls. Her face was etched with worry, and her eyes immediately went to her husband lying on the gurney. Samuel Porter's condition had visibly deteriorated even in the past few minutes, his face pale and drawn with pain. "What's happening to my husband?" Janet Porter demanded, her voice rising with panic. "He looks worse than when the ambulance brought him in. Why isn't he getting better?" Dr. Patrick Fleming immediately shifted into what Dr. Serena Blake recognized as damage control mode. His voice became soothing and authoritative, the kind of tone designed to reassure worried family members while avoiding any real explanation. "Mrs. Porter, please don't worry. Your husband has suffered a significant injury, and healing takes time. We're monitoring his condition very closely and providing the best possible care." Janet Porter wasn't satisfied. "But he's in so much pain, and his leg looks terrible. Shouldn't you be doing something more?" Dr. Serena Blake saw her opportunity and stepped forward. This woman deserved to know the truth about her husband's condition and the treatment options that were being denied to him. "Mrs. Porter, could I speak with you privately for a moment?" Dr. Marcus Donovan had returned to the trauma bay just in time to hear Dr. Serena Blake's request. He immediately positioned himself between Dr. Serena Blake and Janet Porter, his expression furious. "Absolutely not," he said firmly. "Mrs. Porter, please don't let this person confuse you with unauthorized medical opinions. She is not qualified to discuss your husband's care." Dr. Serena Blake felt the walls closing in around her. Every attempt she made to provide proper medical care was being blocked by the prejudice and arrogance of these physicians. She could see Samuel Porter's condition continuing to deteriorate, could see the fear in his wife's eyes, could feel the weight of her professional oath to do no harm being crushed by the racist assumptions of her colleagues. "Your husband needs immediate surgery," she said directly to Janet Porter, ignoring Dr. Marcus Donovan's attempt to silence her. "He has a condition called compartment syndrome that requires emergency treatment." Dr. Marcus Donovan stepped closer to Dr. Serena Blake, his voice low and threatening. "If you say another word to this family, I will have security remove you from this hospital permanently." Janet Porter looked back and forth between them, confusion and fear evident in her expression. "I don't understand what's happening. Who is this woman? And why can't she talk to me about my husband?" Dr. Patrick Fleming moved to Janet Porter's other side, creating a human barrier between her and Dr. Serena Blake. "Mrs. Porter, this person has been disrupting our medical procedures all morning. She has no authority to treat patients in this hospital and no right to discuss medical care with you." "But she seems to know what she's talking about," Janet Porter protested. "And Samuel isn't getting better. Your husband's recovery is proceeding exactly as we would expect," Dr. Marcus Donovan said with false confidence. "These types of injuries require patience and careful monitoring, Surgery would be premature and potentially dangerous at this point. Dr. Serena Blake watched in horror as Samuel Porter's blood pressure continued to drop on the monitors. His kidney function was being compromised by the toxins being released from his dying muscle tissue. His heart was being stressed by the electrolyte imbalances caused by the compartment syndrome. Every system in his body was beginning to fail, and these physicians were reassuring his wife that everything was proceeding normally. The fluorescent lights seemed to grow brighter, casting harsh shadows across the trauma bay as Dr. Serena Blake realized that she was witnessing a preventable tragedy unfold in real time. Her professional expertise, honed over years of training and practice, was being dismissed based solely on the color of her skin. A man was dying because of racist assumptions and medical arrogance, and there seemed to be nothing she could do to stop it. The monitors in Trauma Bay 2 screamed their urgent warnings as Samuel Porter's blood pressure plummeted to 70/40. His heart rate had climbed to 130 beats per minute, and his skin had taken on the grayish pallor that every experienced trauma surgeon recognized as the beginning of irreversible shock. Dr. Serena Blake watched from across the room as the construction worker's body began shutting down, each passing second stealing away his chances of survival. His compartment pressures are over 60 millimeters of mercury. Dr. Serena Blake called out, her voice cutting through the chaos of the trauma bay. She wore her green scrubs and blue jacket under the bright overhead fluorescent lights, her professional demeanor unwavering despite the mounting crisis. You need to perform an emergency fasciotomy immediately or he's going to die. Dr. Marcus Donovan looked up from the patient's bedside, his pristine short-sleeved white coat still spotless despite the medical emergency unfolding around him. His face twisted with irritation as he saw Dr. Serena Blake still present in his trauma bay. I told you to leave. We don't need input from volunteers. Listen to me, Dr. Serena Blake said, stepping closer to the stretcher where Samuel Porter lay unconscious. The tissue death from compartment syndrome is releasing potassium and myoglobin into his bloodstream. His kidneys are failing, and his heart rhythm is becoming unstable. You have maybe 10 minutes before this becomes irreversible. Dr. Claire Simmons, the first-year resident in her orange scrubs, looked between Dr. Serena Blake and Dr. Marcus Donovan with growing confusion. The monitors continued their ominous warnings, and everything Dr. Serena Blake had predicted was coming true with terrifying accuracy. Dr. Donovan, maybe we should consider what she's saying. The patient's condition is deteriorating rapidly. Dr. Simmons, you will follow my orders and ignore this woman's interference. Dr. Marcus Donovan snapped, his voice echoing through the trauma bay. Increase the IV fluids and prepare another dose of epinephrine. Dr. Serena Blake moved closer to the patient, her trained eyes taking in the signs that the trauma team was missing or ignoring. Samuel Porter's legs were swollen to nearly twice their normal size. The skin stretched tight and discolored. When she pressed gently on his shin, the tissue felt rock hard and didn't indent under pressure. Look at his legs, she said urgently. The compartments are so swollen that blood flow has completely stopped. The muscle tissue is dying, and the toxins are poisoning his entire system. Security! Dr. Marcus Donovan shouted suddenly, his voice filled with anger and authority. I need security to Trauma Bay 2 immediately. Nurse Anthony Bell looked up from his documentation station, his pen frozen over the patient chart. He had been quietly recording every observation, every treatment decision, and every warning that Dr. Serena Blake had given. The discrepancies between what she recommended and what Dr. Marcus Donovan was doing painted a disturbing picture of medical negligence. Dr. Donovan, please, Dr. Serena Blake said, her voice taking on a tone of desperate professionalism. I'm going to walk you through the fasciotomy procedure step by step. You make a longitudinal incision along the anterolateral aspect of the leg, extending from just below the fibular head to just above the lateral malleolus. Dr. Patrick Fleming entered the trauma bay at that moment, his short-sleeved white coat and authoritative bearing immediately commanding attention. Dr. Marcus Donovan's longtime colleague and friend surveyed the scene with obvious disapproval, his gaze settling on Dr. Serena Blake with undisguised hostility. "Marcus, what is this woman still doing in your trauma bay?" Dr. Patrick Fleming asked, his voice dripping with disdain. "I thought we established that volunteers need to stay in the designated areas. She won't leave." Dr. Marcus Donovan replied, his frustration evident. "She keeps insisting that she knows how to treat compartment syndrome better than trained physicians." Dr. Serena Blake continued her explanation, knowing that time was running out for Samuel Porter. "After the initial incision, you identify the intermuscular septum and perform a complete fasciotomy of both the anterior and lateral compartments. Then you make a second incision medially to release the superficial and deep posterior compartments." "Enough!" Dr. Marcus Donovan shouted, his face flushed with anger. "I will not have some volunteer undermining my authority and confusing my residents with amateur medical advice." Officer Robert Turner, the hospital security guard, appeared in the doorway of the trauma bay. His uniform was crisp and professional as he took in the scene before him. Dr. Marcus Donovan pointed directly at Dr. Serena Blake, his hand shaking with rage. "Remove this woman from my trauma bay immediately," Dr. Marcus Donovan ordered. "She's interfering with patient care and disrupting our medical procedures." Dr. Serena Blake held her ground, her voice becoming more urgent as she watched Samuel Porter's vital signs continue to deteriorate. "The fasciotomy needs to be performed within 6 hours of symptom onset to prevent permanent damage. We're already past that window, but immediate surgery might still save his life." "Ma'am, I need you to come with me," Officer Robert Turner said, approaching Dr. Serena Blake with professional courtesy but clear authority. "The doctor has requested that you leave this area." "You don't understand," Dr. Serena Blake protested, looking directly at Officer Robert Turner while gesturing toward the patient. "This man is dying from a completely treatable condition. All they need to do is make incisions to relieve the pressure in his leg compartments." Dr. Claire Simmons stepped forward, her voice trembling with uncertainty but growing conviction. "Dr. Donovan, the patient's potassium level just came back at 7.2. His EKG is showing peaked T waves. Everything she's been saying about the pathophysiology has been correct." "Dr. Simmons, you are a first-year resident," Dr. Marcus Donovan said coldly. "You do not have the experience to question attending physician decisions based on the ramblings of an untrained volunteer." Nurse Dorothy Coleman, who had been quietly observing from her station, finally found her voice. "Dr. Donovan, this woman has demonstrated extensive medical knowledge. Maybe we should at least consider her recommendations." "Nurse Coleman, you are out of line," Dr. Patrick Fleming interjected, his voice sharp and authoritative. "Medical decisions are made by physicians, not by nurses, and certainly not by volunteers who wander into trauma bays." Dr. Serena Blake made one final attempt to reach the patient, but Officer Robert Turner gently but firmly placed his hand on her arm. "Ma'am, you need to come with me now." "Please," Dr. Serena Blake said, her voice filled with professional desperation as she looked at Dr. Marcus Donovan. "Just feel his leg compartments. Check the pressures with a manometer. You'll see that I'm right." "Remove her now," Dr. Marcus Donovan ordered, turning his back on Dr. Serena Blake dismissively. Officer Robert Turner began escorting Dr. Serena Blake toward the trauma bay exit, but she continued calling out medical instructions over her shoulder. "When you make the incisions, you'll see the muscle tissue bulging out. That's the pressure being released. The tissue might look dark, but if there's any viability, it needs to be preserved." Dr. Patrick Fleming moved closer to Dr. Marcus Donovan as Dr. Serena Blake was led away. "Marcus, the patient's condition is quite serious. Perhaps we should consider transferring him to Massachusetts General or another facility with more specialized capabilities. Dr. Marcus Donovan's jaw tightened at the suggestion. The implication that he couldn't handle the case struck at his professional pride. "We are perfectly capable of managing this patient here. I've been treating trauma cases for 15 years." From the waiting area where Officer Robert Turner had positioned her, Dr. Serena Blake could still see into the trauma bay through the glass doors. She watched helplessly as the medical team continued their inadequate treatment, while Samuel Porter's condition spiraled beyond any hope of recovery. Nurse Anthony Bell continued documenting everything, his detailed notes creating a comprehensive record of the medical decisions and their tragic consequences. Dr. Claire Simmons approached Dr. Marcus Donovan one more time, her voice barely audible above the sound of the monitors. "Dr. Donovan, his blood pressure is now 50/30. Should we really not try the fasciotomy?" "Dr. Simmons, if you question my medical judgment one more time, you will be removed from this rotation," Dr. Marcus Donovan threatened, his voice cold and final. The young resident stepped back, her face pale with the realization that she was watching a preventable death unfold. She looked toward the waiting area where Dr. Serena Blake stood behind the glass, and their eyes met for a moment that conveyed shared horror and helplessness. Dr. Serena Blake pressed her hands against the glass doors, watching as Samuel Porter's heart rhythm became increasingly unstable on the monitors. The peaked T waves that indicated dangerous potassium levels were becoming more pronounced, and his blood pressure continued its relentless decline toward complete cardiovascular collapse. The construction worker, who had been building a better future for his family, was dying from a condition that should have been treated with a simple surgical procedure. Instead, pride, prejudice, and willful ignorance were transforming a routine medical emergency into an irreversible tragedy that would destroy lives and careers while revealing the deadly consequences of bias in healthcare settings. In the trauma bay, Dr. Marcus Donovan and Dr. Patrick Fleming continued their inadequate treatment protocols while the monitors screamed their warnings and time ran out for Samuel Porter. The crisis point had been reached, and there would be no turning back from the devastating consequences that were about to unfold. The harsh fluorescent lights of the trauma bay cast an unforgiving glare over the scene unfolding before Dr. Serena Blake's eyes. From her position in the waiting area, she could see through the glass partition as the medical team worked frantically around Samuel Porter's deteriorating form. The construction worker's skin had taken on a grayish pallor that she recognized all too well. The monitors showed the telltale signs of systemic collapse that she had tried desperately to prevent hours earlier. Dr. Marcus Donovan, still in his pristine short-sleeved white coat, barked orders at his residents while sweat beaded on his forehead. His earlier confidence had evaporated as Samuel's vital signs continued their downward spiral. The blood pressure reading on the monitor showed dangerously low numbers, while the heart rhythm displayed the irregular patterns that indicated severe electrolyte imbalances. Dr. Serena Blake pressed her hands against the glass, her green scrubs wrinkled from the hours of forced waiting. She knew exactly what was happening inside Samuel Porter's body. The untreated compartment syndrome had progressed to rhabdomyolysis, where the dying muscle tissue was releasing toxic proteins into his bloodstream. His kidneys were shutting down from the overwhelming protein load, and the resulting hyperkalemia was wreaking havoc on his cardiac rhythm. "Why aren't they doing emergency dialysis?" she whispered to herself, watching as Dr. Marcus Donovan continued to focus on treating symptoms rather than addressing the underlying catastrophe. Every second that passed without proper intervention was sealing Samuel Porter's fate. The monitor's alarm suddenly changed pitch, becoming more urgent. Samuel's heart rhythm had shifted into the dangerous territory that Dr. Serena Blake had been dreading. The hyperkalemia from his kidney failure was causing cardiac toxicity, and she could see the medical team's panic as they realized they were losing him. Dr. Claire Simmons, the first-year resident in orange scrubs, looked up from the crash cart with confusion evident on her face. Dr. Donovan, His potassium levels are critically high. Shouldn't we have started dialysis hours ago when his creatinine began climbing? Focus on the cardiac arrest protocol, Simmons. Dr. Marcus Donovan snapped, but Dr. Serena Blake could hear the uncertainty creeping into his voice. He was finally beginning to understand that this wasn't a simple trauma case that he could handle with standard emergency procedures. Through the glass, Dr. Serena Blake watched as they began chest compressions on Samuel Porter. The rhythmic pushing against his chest seemed almost violent under the bright overhead lights, but she knew it was far too little, far too late. The damage from hours of untreated compartment syndrome had created a cascade of organ failure that was now irreversible. Nurse Dorothy Coleman, her experienced hands working efficiently despite the chaos, caught sight of Dr. Serena Blake through the glass. The older nurse's expression showed a mixture of regret and recognition. She had witnessed Dr. Serena Blake's earlier attempts to intervene, had seen the depth of her medical knowledge, and now she was watching the consequences of dismissing that expertise. Charging to 200, called out Dr. Patrick Fleming, Dr. Marcus Donovan's colleague, who had arrived earlier in his short-sleeved white coat. The defibrillator whined as it built up electrical charge, preparing to shock Samuel's heart back into a viable rhythm. Dr. Serena Blake closed her eyes as she heard the distinctive thump of the defibrillator discharge. When she opened them, the monitor showed a brief moment of organized rhythm before deteriorating back into the chaotic pattern of a dying heart. The hyperkalemia had made Samuel's cardiac muscle unresponsive to normal resuscitation efforts. Again, Dr. Marcus Donovan ordered, but his voice lacked the authority it had carried earlier. The reality of the situation was finally penetrating his arrogance. This patient was dying despite their efforts, and deep down, he was beginning to suspect that something had gone terribly wrong with the treatment plan. Nurse Anthony Bell stood at the medication station, his documentation tablet in hand, recording every detail of the resuscitation attempt. His methodical notes captured the timeline of Samuel's deterioration, the medications administered, and the procedures attempted. Unlike the others, he had been quietly observing and documenting since Dr. Serena Blake's initial assessment hours earlier. The automatic doors to the emergency department whispered open, admitting a woman in a red sweater whose anxious expression immediately caught Dr. Serena Blake's attention. This had to be Janet Porter, Samuel's wife, arriving at the worst possible moment. The timing was cruel beyond measure. Janet Porter's eyes immediately found the trauma bay, where her husband lay surrounded by the medical team. Even from a distance, she could see the urgency of their actions, the chest compressions, the array of monitors and machines fighting to sustain life. Her hand flew to her mouth as the reality of the situation struck her. "Ma'am, you need to wait here," said a nurse, gently guiding Janet toward the seating area where Dr. Serena Blake sat. The two women found themselves side by side, both watching through the glass as the medical team worked desperately to save Samuel Porter's life. The defibrillator discharged again, the sound echoing through the trauma bay. This time, the monitor showed no response at all. Samuel's heart had been too damaged by the toxic effects of untreated compartment syndrome to respond to electrical stimulation. Dr. Serena Blake watched Janet Porter's face as she witnessed her husband's final moments. The woman's expression shifted from anxiety to confusion to dawning horror as she realized what she was seeing. The bright natural light, streaming through the emergency department windows, seemed to mock the darkness of the moment unfolding. "Time of death, 1427, Dr. Marcus Donovan announced, his voice barely audible through the glass partition. The words hit Janet Porter like a physical blow, causing her to double over in her chair as the reality crashed down upon her. Dr. Serena Blake felt her own heart breaking as she watched Janet's world collapse. This woman had just become a widow because of medical arrogance and racial prejudice. Samuel Porter had died not from the severity of his injuries, but from the systematic dismissal of expertise that could have saved his life. The trauma bay fell silent as the medical team stepped back from Samuel's body. Dr. Claire Simmons pulled off her gloves with shaking hands, her young face pale with the shock of losing a patient. She kept glancing toward Dr. Marcus Donovan, questions clearly forming in her mind about the treatment decisions that had led to this outcome. Dr. Marcus Donovan emerged from the trauma bay, his white coat now wrinkled and stained, his earlier confidence completely shattered. He approached Janet Porter with the heavy steps of someone carrying unbearable news, though she had already witnessed the truth through the glass partition. "Mrs. Porter," he began, his voice carefully modulated to convey professional sympathy, "I'm very sorry to inform you that your husband has passed away. We did everything we could, but his injuries resulted in complications that we were unable to overcome." Janet looked up at him through tear-filled eyes. "Complications? What kind of complications? He hurt his leg at work. How does that kill someone?" Dr. Serena Blake watched as Dr. Marcus Donovan struggled to explain without admitting the fundamental errors in Samuel's treatment. His explanation focused on the severity of the initial injury, while carefully avoiding any mention of compartment syndrome or the hours of delayed care. "The trauma from the machinery caused extensive damage that led to kidney failure and cardiac arrest," he said, using medical terminology to obscure the true sequence of events. "Sometimes, despite our best efforts, the body cannot recover from such severe injuries." But Janet Porter was not satisfied with vague explanations. "I want to know exactly what happened." Samuel was talking when they brought him in. The paramedic said his vital signs were stable. How did he go from stable to dead? Dr. Serena Blake could no longer remain silent. She stood and approached Janet, her heart heavy with the knowledge of what had truly transpired. "Mrs. Porter, I am so deeply sorry for your loss. My name is Dr. Serena Blake, and I was here when your husband arrived." Janet turned to her with desperate eyes, seeking answers that Dr. Marcus Donovan had failed to provide. "You're a doctor? Can you tell me what really happened?" Before Dr. Serena Blake could respond, Dr. Marcus Donovan intervened. "Dr. Blake was not involved in your husband's care, Mrs. Porter. I can arrange for you to speak with our chaplain or social services about grief counseling." The dismissal in his tone was the same one Dr. Serena Blake had endured for hours, but now it was being used to prevent a widow from learning the truth about her husband's preventable death. The injustice of it ignited something fierce within her. "Mrs. Porter," Dr. Serena Blake said, her voice carrying the authority that Dr. Marcus Donovan had refused to recognize earlier, "your husband presented with classic symptoms of compartment syndrome, a condition that requires immediate surgical intervention to prevent exactly what happened here today." Dr. Marcus Donovan's face flushed red. "Dr. Blake, you are not qualified to make such statements about this patient's care." "Qualified?" The word came out with more force than Dr. Serena Blake had intended. "I have been trying to tell you for hours that Samuel needed an emergency fasciotomy. The signs were unmistakable from the moment he arrived." Janet Porter looked between them, her grief momentarily overshadowed by confusion. "What's a fasciotomy? Could that have saved him?" The question hung in the air like an accusation. Dr. Serena Blake looked at Janet's tear-stained face and knew she deserved the truth, regardless of the consequences. "A fasciotomy is a surgical procedure that relieves pressure in the muscle compartments," Dr. Serena Blake explained gently. "When performed promptly, it prevents the tissue death and organ failure that led to your husband's cardiac arrest." Dr. Marcus Donovan stepped forward aggressively. "Mrs. Porter, Dr. Blake was not part of the treatment team and is not qualified to second-guess the medical decisions made by the attending physicians." But the damage was done. Janet Porter's eyes had sharpened with understanding, and Dr. Claire Simmons had emerged from the trauma bay in time to hear the exchange. The young resident's face showed dawning comprehension as she began to piece together the true sequence of events. Nurse Dorothy Coleman approached the group, her experienced face grave with the weight of what she had witnessed. "Dr. Donovan, perhaps we should discuss the case review process with Mrs. Porter. There will be a standard mortality and morbidity review," Dr. Marcus Donovan replied curtly, clearly eager to end the conversation. "Mrs. Porter, I understand this is an extremely difficult time. Our patient relations coordinator will contact you about the arrangements." Dr. Serena Blake watched as hospital administrator Gerald Hartman appeared, seemingly from nowhere, with the practiced efficiency of someone accustomed to managing crisis situations. His presence immediately changed the dynamic as staff members straightened and conversations became more guarded. "Mrs. Porter, please accept our deepest condolences," Gerald Hartman said, his voice professionally sympathetic. "Our team will provide you with all necessary documentation and support during this difficult time." But Dr. Serena Blake could see the calculation behind his sympathy. This was damage control in action, the systematic effort to manage information and limit liability. She watched as Gerald began subtly directing staff members, undoubtedly preparing them for the documentation and reporting that would follow. Dr. Claire Simmons lingered nearby, her young face troubled by questions she was afraid to voice. Dr. Serena Blake caught her eye and saw the internal struggle of someone who had witnessed something wrong but lacked the authority or confidence to challenge it directly. Nurse Anthony Bell continued his methodical documentation, his tablet capturing details that others might prefer to see forgotten. His quiet professionalism had created a record that would prove invaluable in the investigation that Dr. Serena Blake knew must follow. As the group began to disperse, Dr. Serena Blake found herself alone with Janet Porter in the waiting area. The widow sat staring at her hands, trying to process the sudden transformation of her life from ordinary Tuesday afternoon to unthinkable tragedy. "Mrs. Porter," Dr. Serena Blake said softly, "I want you to know that your husband's death was preventable. What happened here today was not standard care, and you deserve to have that investigated." Janet looked up with eyes that held both grief and growing anger. "You really think they made mistakes?" "I know they did," Dr. Serena Blake replied, her voice carrying absolute certainty. "I have been treating compartment syndrome for 20 years. And I have never lost a patient who received timely intervention." The weight of that statement settled between them. Janet Porter was beginning to understand that her husband had died not from the unavoidable complications of a traumatic injury, but from medical negligence that could have been prevented by proper treatment. "What do I do now?" Janet asked, her voice barely a whisper. Dr. Serena Blake looked around the emergency department, taking in the scene of Gerald Hartman coaching staff members and Dr. Marcus Donovan retreating to his office. The cover-up was already beginning, the careful construction of narratives that would protect the hospital's reputation at the expense of truth and accountability. She pulled out her cell phone, her fingers steady despite the emotional turmoil of the day. There was a call she needed to make, one that would bring the expertise and authority necessary to ensure that Samuel Porter's death was properly investigated and that justice was served. "Mrs. Porter, I am going to make sure that what happened here today is thoroughly investigated by the appropriate medical authorities," she said, her voice carrying a promise that extended far beyond simple condolences. As she dialed the number, Dr. Serena Blake knew that this phone call would change everything. The tragedy of Samuel Porter's preventable death would not be buried under hospital politics and damage control. The truth would emerge, and those responsible would face the full consequences of their deadly prejudice and incompetence. The call connected, and Dr. Serena Blake began to speak with the calm authority of someone who had finally reached the limit of what she was willing to tolerate in silence. The fluorescent lights of the community hospital's main corridor cast their harsh glare across the polished linoleum floors as Dr. Serena Blake stood near the nurses' station, her green scrubs and blue jacket a stark contrast to the sterile white walls surrounding her. She had just witnessed Samuel Porter's preventable death, and the weight of that tragedy pressed down on her shoulders like a physical force. The phone call she had made 20 minutes earlier would change everything, but the hospital staff remained blissfully unaware of the storm approaching their doors. Dr. Marcus Donovan emerged from the trauma bay, his short-sleeved white coat pristine despite the failed resuscitation efforts. His face carried the practiced expression of clinical detachment that physicians learned to wear after losing patients. But there was something else there too, a smugness that suggested he felt vindicated in his earlier dismissal of Dr. Serena Blake's expertise. He approached the nurses' station where several staff members had gathered, their voices low as they discussed the morning's events. The automatic doors of the hospital's main entrance whooshed open with mechanical precision, and two figures strode through with the unmistakable bearing of medical authority. Dr. Vivian Nguyen, Chief Medical Officer at Massachusetts General Hospital, wore a crisp red blazer over her white coat, her presence commanding immediate attention from everyone in the corridor. Beside her walked Dr. Raymond Castillo from the State Medical Board, his muscular frame filling out his navy suit as his sharp eyes took in every detail of the scene before him. Dr. Serena Blake moved toward them with measured steps, her professional composure intact despite the emotional turmoil of the past few hours. The reunion was brief but telling as Dr. Nguyen placed a supportive hand on Dr. Blake's shoulder, their familiarity obvious to anyone watching. The gesture sent ripples of confusion through the gathered hospital staff, who had spent the morning dismissing this woman as an unqualified volunteer. Nurse Dorothy Coleman was the first to approach, her decades of experience telling her that something significant was about to unfold. She had watched Dr. Serena Blake's attempts to intervene throughout the morning, noting the precision of her medical observations and the sophistication of her clinical reasoning. Now, seeing her interact with these obvious authority figures, Dorothy felt a growing sense of dread about what they had all witnessed. Dr. Marcus Donovan's expression shifted from confusion to concern as he watched the interaction unfold. He strode forward with his usual confidence, extending his hand toward the newcomers with the practiced smile he reserved for hospital administrators and visiting dignitaries. His introduction died on his lips as Dr. Nguyen's cold stare met his outstretched hand, her professional courtesy notably absent. Dr. Raymond Castillo stepped forward, his voice carrying the weight of official authority as he addressed the assembled staff. The words he spoke would echo through the corridors of the hospital for months to come, forever changing how everyone present understood the events of that morning. He identified himself and his position with the State Medical Board, explaining that they were there to investigate allegations of medical negligence and professional misconduct. The revelation began slowly, building like a medical diagnosis that starts with subtle symptoms before revealing a devastating truth. Dr. Nguyen introduced Dr. Serena Blake not as the volunteer the hospital staff had assumed, but as the chief of orthopedic surgery at Massachusetts General Hospital, one of the nation's most prestigious medical institutions. The words hung in the air like surgical instruments suspended over an operating table, sharp and precise in their ability to cut through assumptions. Dr. Patrick Fleming, who had arrived earlier to support his colleague Dr. Marcus Donovan, felt his face flush as the implications became clear. He had participated in dismissing someone whose medical credentials far exceeded his own, whose expertise in trauma surgery was internationally recognized. His attempts at damage control began immediately, his voice taking on a conciliatory tone as he tried to explain their earlier behavior as a simple misunderstanding. The detailed recitation of Dr. Serena Blake's achievements continued with methodical precision. Dr. Nguyen outlined her colleagues' extensive training, including her fellowship in orthopedic trauma surgery at Johns Hopkins, her board certifications, and her specialized expertise in compartment syndrome treatment. She had authored over 50 peer-reviewed publications on the subject, developed new surgical techniques that had become standard practice, and served as a consultant to hospitals worldwide. Dr. Claire Simmons, the first-year resident who had begun questioning the morning's treatment decisions, felt her stomach drop as she realized the magnitude of what had occurred. She had watched a world-renowned expert in compartment syndrome be dismissed and removed from the trauma bay while a patient died from the very condition she specialized in treating. The young doctor's face paled under the fluorescent lighting as she grappled with her role in the tragedy. Hospital Administrator Gerald Hartman's demeanor underwent a complete transformation as the legal and professional implications crashed down on him like a collapsing building. His earlier support of Dr. Marcus Donovan's authority now appeared as institutional endorsement of medical negligence and racial discrimination. The carefully maintained facade of administrative competence crumbled as he realized his hospital had just become the center of a medical malpractice case that would attract national attention. Dr. Serena Blake's voice remained steady and professional as she began documenting the specific instances of medical negligence she had witnessed. Her analysis was clinical and precise, detailing how Samuel Porter's compartment syndrome could have been diagnosed within the first 30 minutes of his arrival. She explained the standard diagnostic criteria, the pressure measurements that should have been taken, and the emergency fasciotomy that could have saved his life. The medical staff gathered in the corridor listened with growing horror as Dr. Blake outlined the cascade of errors that had led to Samuel Porter's death. She detailed how his initial symptoms, the mechanism of injury from the construction accident, his pain levels, and the physical findings all pointed clearly to compartment syndrome, requiring immediate surgical intervention. Every delay, every dismissed symptom, every moment of inaction was cataloged with the precision of a forensic investigation. Nurse Anthony Bell stepped forward with his carefully maintained documentation, his notes providing a minute-by-minute account of the morning's events. His records showed Dr. Serena Blake's repeated attempts to provide input, her accurate assessments of the patient's deteriorating condition, and the staff's consistent dismissal of her expertise. The nursing notes painted a damning picture of institutional bias overriding medical judgment. Dr. Marcus Donovan's face had transformed from confusion to horror as the full impact of his actions became clear. The woman he had dismissed as an unqualified volunteer, the person he had mocked and had removed by security, was not only a physician, but one of the world's leading experts in exactly the condition that had killed Samuel Porter. His medical career, built over decades of training and practice, was crumbling before his eyes as the weight of his prejudice and arrogance became undeniable. The revelation created a domino effect throughout the hospital staff as individuals began to understand their roles in the morning's tragedy. Those who had remained silent while witnessing Dr. Serena Blake's obvious expertise now faced the reality that their inaction had contributed to a preventable death. The institutional culture that had supported Dr. Marcus Donovan's authority without question was exposed as a system that valued hierarchy and assumptions over medical evidence and patient care. Dr. Nguyen's presentation of Dr. Serena Blake's credentials continued with her international recognition, including her role as a consultant to trauma centers across 3 continents, her position on multiple medical boards, and her research grants totaling millions of dollars. The woman who had been treated as an ignorant volunteer was revealed to be someone whose expertise was sought by the most advanced medical institutions in the world. The silence that followed this revelation was profound, broken only by the ambient sounds of the hospital around them. The fluorescent lights hummed overhead, casting their unforgiving illumination on faces marked by shock, shame, and growing understanding of the consequences to come. The morning's events were transformed from a routine patient loss into a case study in how racial bias and institutional prejudice could prove fatal. Dr. Raymond Castillo began outlining the immediate steps that would follow, including formal investigations, medical board reviews, and the suspension of clinical privileges pending comprehensive examination of the case. The bureaucratic machinery of medical accountability was already beginning to turn, and its wheels would crush everything in their path as justice demanded its due. As the group moved toward the hospital's administrative offices, Dr. Serena Blake walked with the quiet dignity of someone whose professional integrity had been vindicated through tragedy. Her green scrubs and blue jacket, so recently dismissed as inappropriate attire, now represented the uniform of medical excellence that had been ignored at the cost of human life. The revelation was complete, but the reckoning was just beginning. The fluorescent lights in the hospital conference room cast harsh shadows across the mahogany table where Dr. Raymond Castillo spread out his investigation files. The bright morning sunlight streaming through the tall windows illuminated every damning piece of evidence he had compiled over the past week. Dr. Serena Blake sat composed in her green surgical scrubs and blue jacket, her posture radiating the quiet confidence of someone who had finally been vindicated after enduring the unthinkable. Dr. Marcus Donovan entered the room wearing his short-sleeved white coat, but the arrogance that had defined him just days earlier had been replaced by something far more unsettling, the haunted look of a man watching his entire world collapse. His hands trembled slightly as he took his seat across from the medical board investigator, avoiding eye contact with Dr. Serena Blake entirely. Dr. Donovan, Dr. Raymond Castillo began, his voice carrying the weight of official authority. This preliminary investigation has uncovered serious violations of medical standards that directly contributed to Samuel Porter's preventable death. The evidence suggests gross negligence and possible criminal liability. The words hung in the air like a death sentence. Dr. Marcus Donovan's face went pale as Dr. Raymond Castillo outlined the specific charges being considered: failure to diagnose compartment syndrome despite clear symptoms, dismissal of expert medical intervention based on racial bias, and obstruction of proper patient care that resulted in wrongful death. Dr. Serena Blake watched as her former tormentor struggled to process the magnitude of his situation. The same man who had laughed at her credentials and called security to have her removed now faced the systematic destruction of everything he had worked to build. The irony was not lost on anyone in that brightly lit conference room. Furthermore, Dr. Raymond Castillo continued, sliding photographs across the polished table, "Our investigation has revealed a pattern of discriminatory behavior at this institution that extends far beyond this single incident. Dr. Donovan, your dismissal of Dr. Blake's expertise appears to be part of a broader issue of racial bias affecting patient care." The hospital's new interim administrator, Dr. Elizabeth Hayes, a middle-aged woman in an orange blouse and blue jacket, nodded grimly as she reviewed the documentation. She had been brought in specifically to clean house after Gerald Hartman's termination for attempting to cover up the incident and failing to investigate Dr. Serena Blake's credentials properly. "The medical board will be suspending your license pending a full hearing," Dr. Raymond Castillo informed Dr. Marcus Donovan, whose world was crumbling with each carefully measured word. "Additionally, this hospital is terminating your employment immediately, and the district attorney's office is considering charges of negligent homicide." Dr. Serena Blake felt a complex mix of emotions as she witnessed this moment of reckoning. There was satisfaction in seeing justice served, but it was tempered by the tragic knowledge that Samuel Porter's life could never be restored, no matter how thoroughly his negligent care was punished. The conference room door opened to admit Attorney Diane Wells, a sharp-eyed woman in a red power suit who had taken Janet Porter's wrongful death case. Her presence signaled that the legal consequences would extend far beyond medical board sanctions and professional disgrace. "Dr. Blake," Attorney Diane Wells said respectfully, "your expert testimony will be crucial in establishing the standard of care violations that led to Mr. Porter's death. The family deserves justice, and your professional analysis will help ensure they receive it." Dr. Marcus Donovan, finally looked up at Dr. Serena Blake, and she could see the full weight of his realization reflected in his eyes. This was the woman he had dismissed as an unqualified volunteer, the expert whose life-saving intervention he had blocked with his arrogance and prejudice. The same woman who was now calmly and professionally documenting every aspect of his medical negligence. Dr. Blake's credentials speak for themselves. Dr. Raymond Castillo stated, reading from her extensive file, Chief of Orthopedic Surgery at Massachusetts General Hospital, internationally recognized expert in compartment syndrome treatment, author of over 50 peer-reviewed publications on trauma surgery. Her attempts to provide proper medical care were dismissed based solely on racial assumptions. The systematic nature of the investigation was devastating in its thoroughness. Dr. Patrick Fleming, Dr. Marcus Donovan's longtime colleague who had supported the negligent treatment, faced his own disciplinary hearing in the adjacent conference room. His short-sleeved white coat could not hide the sweat stains that betrayed his anxiety as he awaited his turn to face the consequences of his actions. Dr. Elizabeth Hayes addressed the broader implications of the investigation. This incident has exposed serious systemic problems at our institution. We are implementing immediate policy changes including mandatory bias training, diverse medical teams for complex cases, and protocols requiring consultation when outside expertise is offered by credentialed physicians. The bright overhead lighting revealed every detail of Dr. Marcus Donovan's deteriorating composure as the full scope of his downfall became clear. His medical career, built over decades of study and practice, was being methodically dismantled because of his inability to see past his racial prejudices, to recognize obvious medical expertise. Dr. Serena Blake spoke for the first time during the proceedings, her voice steady and professional despite the emotional weight of the moment. Samuel Porter presented with classic compartment syndrome symptoms. Early fasciotomy would have saved his life. The delay in proper treatment was entirely preventable. Her expert analysis was devastating in its simplicity and clarity. She outlined exactly how the case should have been handled, contrasting proper medical protocols with the negligent care actually provided. Every word was documented, every recommendation recorded for the inevitable legal proceedings that would follow. The investigation had also revealed disturbing details about the attempted cover-up. Gerald Hartman, the former hospital administrator, had coached staff members on their incident reports and attempted to minimize the severity of the medical errors. His termination sent a clear message that institutional protection of negligent staff would no longer be tolerated. Dr. Claire Simmons, the first-year resident who had begun questioning Dr. Marcus Donovan's approach, was commended for her willingness to challenge authority when patient care was compromised. Her orange scrubs had been replaced with the professional attire of someone whose career prospects had improved dramatically through her moral courage. Nurse Dorothy Coleman and Nurse Anthony Bell, who had recognized Dr. Serena Blake's expertise and documented the discrepancies they observed, received formal recognition for their professionalism. However, other staff members who had remained silent despite witnessing obvious medical negligence faced disciplinary action and mandatory additional training. The media attention surrounding the case had grown exponentially as details of the incident became public. National news outlets were covering the story as an example of how racial bias in healthcare settings could have fatal consequences. The hospital found itself under intense scrutiny as reporters examined other potential cases of discriminatory treatment. Dr. Raymond Castillo continued his methodical destruction of Dr. Marcus Donovan's professional standing. The evidence shows that Dr. Donovan's decision-making was compromised by racial bias to such an extent that he ignored obvious medical expertise and blocked life-saving treatment. This represents a fundamental violation of medical ethics and professional standards. The legal settlement negotiations were proceeding in parallel with the medical board investigation. Attorney Diane Wells had assembled an overwhelming case demonstrating how proper medical care could have prevented Samuel Porter's death. The financial compensation being discussed was substantial, reflecting both the economic impact on Janet Porter and the punitive damages warranted by the egregious nature of the negligence. Dr. Serena Blake's role as expert witness in the wrongful death proceedings would be crucial in establishing the specific ways that medical standards had been violated. Her testimony would explain in clear terms how compartment syndrome should be treated and exactly how the delayed care had caused Samuel Porter's preventable death. The investigation had also uncovered other instances of discriminatory behavior at the hospital. Patient complaints about dismissive treatment, staff reports of biased decision-making, and patterns of unequal care had created a comprehensive picture of systemic problems that extended far beyond the single tragic incident. Dr. Patrick Fleming's career was suffering similar devastation as his role in supporting the negligent treatment became clear. His medical privileges had been suspended, and his professional reputation was destroyed by his association with the case. The colleague who had so readily dismissed Dr. Serena Blake's expertise now faced his own reckoning with the consequences of prejudice. The bright conference room lighting illuminated every document, every photograph, every piece of evidence that demonstrated how racial bias had led directly to a preventable death. The fluorescent bulbs cast harsh shadows that seemed to emphasize the gravity of the moment as careers were destroyed and justice slowly emerged from tragedy. Dr. Elizabeth Hayes outlined the comprehensive policy changes being implemented throughout the hospital system. We are establishing protocols that require immediate consultation when credentialed physicians offer expertise, regardless of their formal affiliation with our institution. The Samuel Porter case will serve as a training example of how bias can compromise patient care. As the formal proceedings concluded, Dr. Serena Blake reflected on the complex emotions she was experiencing. The vindication was satisfying, but it came at too high a price. Samuel Porter's life could not be restored, and Janet Porter's grief could not be erased, no matter how thoroughly justice was served. The systematic dismantling of Dr. Marcus Donovan's career would continue over the coming months as criminal proceedings moved forward and the medical board completed its comprehensive review. His name would become synonymous with how racial prejudice could corrupt medical judgment and lead to fatal consequences. The precedent being established through this case would have implications far beyond the immediate participants. Medical institutions across the country would be forced to examine their own policies and training programs to prevent similar tragedies from occurring. Dr. Serena Blake gathered her materials as the meeting concluded, knowing that her work as an advocate for systemic change was just beginning. The bright morning sunlight streaming through the conference room windows seemed to promise that something positive could emerge from this tragedy if the lessons learned were applied broadly enough to prevent future incidents. The justice unfolding in that brightly lit room was comprehensive and swift, but it carried the bitter knowledge that it had come too late for Samuel Porter. The price of prejudice had been measured in the most precious currency of all, human life. 6 months after Samuel Porter's preventable death, the morning sun streamed through the tall windows of the Massachusetts Medical Center's main auditorium, casting natural light across hundreds of physicians, nurses, and healthcare administrators gathered for the National Conference on Healthcare Equity. At the podium, illuminated by bright overhead fluorescent lights, stood Dr. Serena Blake in her signature green blouse and blue jacket, her voice carrying across the packed auditorium with the authority that had been so cruelly dismissed that tragic day. Healthcare bias doesn't announce itself with dramatic proclamations, Dr. Serena Blake told the rapt audience. It whispers in assumptions about competence based on appearance. It speaks in the dismissal of expertise because it doesn't match preconceived notions, and sometimes it kills. The audience hung on every word as she detailed the systematic failures that led to Samuel Porter's death. This was her 7th speaking engagement this month, part of a nationwide tour that had transformed her from a respected surgeon into a powerful voice for change in American healthcare. In the front row, Dr. Raymond Castillo from the State Medical Board nodded approvingly. The investigation he had led had become a landmark case, referenced in medical journals and legal proceedings across the country. The changes implemented because of Dr. Serena Blake's advocacy were already saving lives in hospitals nationwide. The Samuel Porter Protocols, Dr. Serena Blake continued, require immediate consultation when compartment syndrome is suspected. But more importantly, they require us to check our biases at the door and listen to expertise regardless of its source. The applause was thunderous, but Dr. Serena Blake's mind wasn't on the accolades. She was thinking about the transformation that had occurred at the small community hospital where everything began. 3 hours later, Dr. Serena Blake's car pulled into the parking lot of Riverside Community Hospital. The building looked the same, but everything inside had changed. The moment she walked through the automatic doors, she was greeted by Dr. Claire Simmons, now the Chief of Emergency Medicine, wearing orange scrubs under the bright hospital lighting. "Dr. Blake, welcome back," Dr. Claire Simmons said warmly, extending her hand with genuine respect. "Thank you for agreeing to oversee our first quarterly bias training session." The contrast with Dr. Serena Blake's first visit couldn't have been more stark. Where once she had been dismissed and ignored, now she was welcomed as the distinguished expert she had always been. The hospital's transformation under new leadership had been swift and comprehensive. "How has the implementation been going?" Dr. Serena Blake asked as they walked through the emergency department. "Revolutionary," Dr. Claire Simmons replied. "We've had 3 cases of suspected compartment syndrome since the protocols were implemented. Each time, immediate consultation was requested, proper procedures followed, and all 3 patients made full recoveries." They passed the trauma bay where Samuel Porter had died. A new plaque on the wall read, "Samuel Porter Memorial Trauma Bay, where every voice matters, every expert is heard." Dr. Serena Blake paused, remembering the desperate frustration of that day, now transformed into lasting change. Nurse Dorothy Coleman approached, wearing her standard blue uniform, her face showing a mixture of respect and lingering regret. "Dr. Blake, I wanted to personally thank you for what you've accomplished here. We're not the same hospital we were 6 months ago." "None of us are the same people we were," Dr. Serena Blake replied gently. "Growth requires acknowledging past failures and committing to better." The afternoon training session drew staff from every department. Dr. Serena Blake presented case studies, not just of Samuel Porter's preventable death, but of successful interventions when bias was overcome and expertise was respected. The audience was engaged, asking thoughtful questions and sharing their own experiences with unconscious bias in medical settings. During a break, Hospital Administrator Maria Santos approached. She had replaced Gerald Hartman after his termination and criminal charges for attempting to cover up the incident. "Dr. Blake, I have an update on the legal proceedings you might find interesting." Dr. Serena Blake listened as Maria Santos explained the latest developments. Dr. Marcus Donovan's medical license had been permanently revoked by the State Medical Board. The criminal case for negligent homicide was proceeding to trial, with prosecutors confident of conviction. His career in medicine was over, his reputation destroyed, his arrogance having cost not only Samuel Porter's life, but his own professional future. Dr. Patrick Fleming had faced similar consequences. Stripped of his clinical privileges, he now worked in medical billing at a small clinic, his career reduced to administrative tasks after decades of practice. The investigation had revealed a pattern of discriminatory behavior from both physicians, with other cases coming to light as victims found the courage to speak out. "Justice has been thorough," Maria Santos concluded. "But more importantly, the changes you've helped implement are preventing other tragedies." That evening, Dr. Serena Blake attended the monthly meeting of the Samuel Porter Foundation, established by Janet Porter, to combat medical discrimination and improve emergency care protocols. The Foundation's offices were modest but bustling with activity, illuminated by bright fluorescent lighting that revealed the determined faces of advocates working to prevent other families from suffering similar losses. Janet Porter, wearing a red blouse that honored the visual standards while reflecting her ongoing grief, welcomed Dr. Serena Blake with a warm embrace. "Serena, I can never thank you enough for everything you've done. Samuel's death wasn't meaningless if it prevents others from dying the same way." The Foundation had already funded bias training programs at 12 hospitals, established emergency medicine scholarships for underrepresented minorities, and created a network of expert consultants available for immediate consultation in complex cases. The impact was measurable and growing. "Your husband's memory has become a force for healing," Dr. Serena Blake told Janet Porter. "The protocols bearing his name have already saved dozens of lives." The meeting included presentations from hospitals that had implemented the Samuel Porter protocols. Dr. Serena Blake listened to success stories, cases where immediate consultation had led to proper diagnosis and treatment, where bias training had changed attitudes and improved outcomes. Each story represented a life saved, a family spared the devastating loss that Janet Porter had endured. As the meeting concluded, Dr. Serena Blake reflected on the unexpected journey that had brought her to this moment. 6 months ago, she had been a respected surgeon focused primarily on her clinical work. Now she had become a national advocate, her voice carrying weight in policy discussions and her expertise sought by hospitals nationwide. The transformation hadn't been easy. The media attention following the case had been intense, with some outlets questioning whether she had done enough to save Samuel Porter. But the medical community had rallied around her, recognizing that she had been the victim of systematic discrimination that had prevented her from providing life-saving care. Her research on compartment syndrome had gained new attention, with medical schools now including her protocols in their curricula. The case had become a textbook example of how bias could interfere with medical judgment, studied in ethics classes and diversity training programs across the country. 2 days later, Dr. Serena Blake returned to Riverside Community Hospital for an emergency consultation. The irony wasn't lost on her as she hurried through the same doors where she had once been dismissed as a volunteer. This time, she had been specifically requested by Dr. Claire Simmons for a case that would test everything they had learned. The patient was Michael Rodriguez, a 28-year-old construction worker who had been crushed by falling concrete. His symptoms were textbook compartment syndrome, but the similarities to Samuel Porter's case created anxiety among the medical staff who remembered that tragic day. "We've administered pain medication and begun monitoring protocols," Dr. Claire Simmons reported as they approached the trauma bay. "But given the mechanism of injury and symptom presentation, we immediately called for your consultation." Dr. Serena Blake examined the patient under the bright fluorescent lights of the trauma bay where Samuel Porter had died. Michael Rodriguez's leg showed the classic signs: severe pain, swelling, and decreased sensation. His pressure readings confirmed her suspicions. "This is definitely compartment syndrome," she confirmed. "We need immediate fasciotomy to prevent tissue death and systemic complications." This time, there was no argument, no dismissal, no assumption about her qualifications. The surgical suite was prepared immediately, with Dr. Serena Blake leading the procedure while teaching the technique to observing residents. Her hands moved with practiced precision, making the incisions that would save Michael Rodriguez's leg and possibly his life. "The key is rapid decompression," she explained to the residents as she worked. "Delay means permanent damage. Trust the clinical signs, act quickly, and don't let pride or bias interfere with proper care." The surgery was successful. Michael Rodriguez's circulation was restored, the pressure relieved, the tissue preserved. He would make a full recovery, able to return to work and his family thanks to immediate proper treatment. As Dr. Serena Blake cleaned up after the procedure, She was approached by Dr. Simmons and several residents who had observed the surgery. "Thank you for not only saving his leg, but for showing us exactly how it should be done," said Dr. Jennifer Walsh, a second-year resident in Orange Scrubs. The difference between this outcome and what happened to Mr. Porter is exactly why these protocols exist. Dr. Serena Blake nodded, feeling a sense of completion that had been missing since that terrible day 6 months ago. This is what should have happened then. This is what will happen going forward when we check our assumptions and respect expertise wherever we find it. Later that evening, as Dr. Serena Blake drove back to Boston, she reflected on the remarkable transformation that had emerged from tragedy. Samuel Porter's preventable death had sparked changes that would save countless lives. The hospital that had once dismissed her was now a model for bias-free medical care. The physicians who had ignored her expertise faced justice and consequences that ended their careers. Most importantly, the medical community was having conversations about bias and discrimination that had been long overdue. Her speaking engagements were booked months in advance, with hospitals eager to implement training programs and protocols that would prevent similar tragedies. The Samuel Porter protocols had been adopted by over 200 hospitals nationwide, with more implementing them each month. Medical schools were revising their curricula to include bias training and cultural competency requirements. The case had become a catalyst for systemic change that extended far beyond one hospital or one tragic death. Dr. Serena Blake's phone rang as she entered Boston traffic. It was Janet Porter, calling with news about the criminal trial. "The prosecutor says Dr. Donovan's case is going to trial next month," Janet Porter reported. "They're confident of conviction on negligent homicide charges. He could face up to 5 years in prison." The legal consequences felt appropriate to Dr. Serena Blake. Dr. Marcus Donovan's arrogance and bias had killed a man, and he would face the full weight of justice for that crime. But the systemic changes felt more important, the lasting impact that would prevent other deaths and transform how medical expertise was recognized and respected. "Your husband's memory is creating change that will outlast all of us," Dr. Serena Blake told Janet Porter. "That's his true legacy." As she pulled into her own hospital's parking garage, Dr. Serena Blake felt a deep sense of purpose. Her clinical work continued, but her advocacy had given her career new meaning. Tomorrow she would perform 3 surgeries, train residents, and review protocols that ensured excellent patient care regardless of who provided it. The tragedy of Samuel Porter's death had been transformed into a force for justice and change. Dr. Marcus Donovan's career was destroyed, his freedom in jeopardy, his name forever associated with deadly bias. The hospital had been transformed, its culture rebuilt around respect for expertise and commitment to equity. And Dr. Serena Blake had found her voice as an advocate, using her expertise not just to heal individual patients, but to heal the systemic problems that had nearly made her an unwilling witness to preventable death. 6 months later, the changes continued to ripple outward, creating waves of transformation that would protect future patients and honor the memory of one man whose death had sparked a revolution in American healthcare. You just heard a story that history tried to overlook. If it stayed with you, take a second to stand with it. Subscribe, share, and help us keep telling the stories that deserve light, not silence.